Well, good afternoon or good morning, good evening, everyone. It's a real pleasure to welcome you all to the Leading Voices in Public Health lecture series today. I'm Randy Wyckoff, the Dean of the College of Public Health at East Tennessee State University. This lecture series goes back to 2007, but I think I can honestly say that I've probably not looked forward to one as much as this one. It's a topic that's both extremely important and one that we don't discuss enough. I'm extremely pleased to have Dasho from Bhutan, where it is 10 o'clock at night. Over the years, we've tried the Leading Voices at different times, but never quite that late. Dr. Ura was educated in India and then at Oxford and then at Edinburgh University. He is the president of the Center for Bhutan Studies and CrossNational Happiness Research, received multiple international awards, and is, in addition to being a scholar, he's written a number of books. I am absolutely thrilled to have him join us. And Karma, I will turn it over to you. Thank you for being here with us today.
Thank you very much. Am I clear in terms of?
Yes, we can hear you well.
Okay. First of all, I'd like to thank Professor Randy for your kind invitation. It's a great opportunity for me to be in touch with you and to know more about your very esteemed institution. Somehow I feel it is next door today, your institution. So I like to also offer my greetings to your faculty, your students, and others who might be present amongst the audience this evening or this morning. If you hear a scratchy wooden sound, please do excuse me. It is the rat population in the ceiling above me. I'm trying to coexist with them. It must be also difficult to autumn night for them. So, so thank you very much for your kind invitation. I thought I will start by saying that a nation as an organization can be interpreted in many ways as a defender of our cherished values, as states which give us some security. But over here in the Himalayas, if we look at the literature, a nation is often thought of as an enduring stage where human beings, and by extension of imagination, you can think of other creatures also as a nation as a stage where they can transform towards a peaceful and calm state. This has been projected as the purpose of the state and explicitly written down in foundation documents of countries like Bhutan. So for over the last 500 years or so of the existence of Bhutan as a state, it has tried to attempt to manifest this dream, the dream of a cherished stage where people sort of can transform themselves into a peaceful and calm state. Now, of course, in the recent years, last 2 years, as you all know, this dream is also intruded upon by COVID pandemics and such kind of sudden adversities. And they test the philosophy of the state, they test leadership, and they test also our values. And I would like to share with you I think it's relevant really as a great school of public health that in this country, we have given absolute priority to protection of life instead of economy and livelihood. So Bhutan has, due to the leadership of a Buddhist monarch, come through this pandemics very well, I think, because of this unwavering priority given to protecting people from infection, and then those who got infections also protecting them from untimely loss of life. So, in the neighborhood, Bhutan has a slightly superior record, if I may say, in this regard. Only 2,600 or so people got infected. And out of that, 3 persons with underlying conditions, out of which one was an Indian elderly gentleman visiting Bhutan. So 3 passed away during this 2-year pandemic. And the vaccination rate has reached 94%. So we are contemplating the 3rd jab, but almost all the all citizens above the age of 12 has been vaccinated very successfully. But I like to bring back this extraordinary achievement in this country with regard to pandemic control, also to consciousness of GNH as a collective value. That is why. That is that everybody values their life as irreplaceable, and therefore we do everything to protect people from this kind of untimely end to life. But GNH, as I said, represents potential of both our mind and body towards a much deeper peace, calmness, and happiness. That is what it represents. And at the same time, we are informed in this GNH philosophy of the multiple sources of our pain and suffering, of relational intimate breakdown that also devastates individuals' happiness, and of personal traumas, and cognitively also aware of the fact that we confuse means and ends in life quite seriously. But programs such as GNH, social agenda set up by our 4th king, the founder of GNH, is not only about individuals' life quest for happiness and joy. We face today, as you all know, issues larger than suffering, pain, and mortality that affects individual and are individual issues. But we have to know that we have to appreciate significantly in our approach also that planet itself is quite ill. Probably some even say from their forecast that it is dying. And it is doing so because of the enormous pressure, enormous consumption pressure that human beings had put on it over the last 3 years, and in particular over the last 100 years. So it's much bigger than individual issues about unhappiness, about aging, about death, about parting. So the GNH, in a way, is also a tool for balancing between this singular emphasis on increasing the amount of things in the world, amount of produced things in the world, without much regard to what kind of things are produced. After all, one of our leading measures of progress in the world today is GDP, which is singularly concerned with amount, how much is produced, not what kind of things are produced. We have not been able to distinguish that too much in a discerning way. So we are compelled by this yardstick to regard always more as better. So GNH is also informed about that. With this brief introduction overview, I'd like to take up now a little bit to introduce you to GNH from the angle of institutional development or background, institutional development. So our institute, the Center for Bhutan and CrossNational Happiness Studies, here in Thimphu, with about 100 graduates in the think tank, has this responsibility of triggering application of cross-national happiness in government policies and businesses, and if possible, also outside. It was, as I mentioned, it was founded by His Majesty the Fourth King in the 1970s. He is now in his mid-60s. He's a very important figure in the Himalayas, by the way. He's very inspirational to the young and the old in this country, not because he is king, but because he's a very disciplined person. He leads a very disciplined life, and his decisions are hallowed by his clarity on both what should be done and what should not be done. One can lose a lot of time and resource, as you know, by doing what should not be done. It's very difficult to reverse once you set off things, you know. They have their own life because we establish institutions pursuing them, we allocate budget. So it's very important to decide not to do things, in my opinion. And that's one of the things we learn, you know, from him. And he is also the one who abdicated in 2006. But before his abdication in 2002, he started the process of drafting a constitution for the Kingdom of Bhutan along modern lines. And that led to multi-party democracy. And today we are governed by a cabinet, by a parliament, which is elected, you know, through universal franchise. So this is the context, administrative context I'm trying to mention to you. In the constitution, there is also provision that obliges the government to pursue policies that are good conditions for cross-national happiness. There is a constitutional provision. Bhutanese constitution, having been drafted with lessons from other constitutions, have very strong provisions on these sort of things. It also has very strong provisions on protection of forest. And minimum of 60% of the land surface of the country should be permanently under pristine forest, it states. Today we have about 72%. So he abdicated, and we have had a new king since 2008, His Majesty Jigme Khesar. By the way, he had the benefit of studying some years in United States. So I'm very proud of this experience he had, educational and others. You might be aware, you might have seen his photograph. He's an extremely handsome man, highly qualified, very futuristic, and very interested in evaluating AI and things like that. But it is one thing to be very technical and aware of technologies, organizations, but it's quite another to have authenticity in the care of people. I think only a person who embodies this authentic care for people can today lead a nation or population well, because the vicissitudes of time are such that we always get very regularly into minor or major crises. And we have been visited all around the world, as you know, by all sort of crises. 2008, 2006 to 8, financial crisis, again 2014, and around here, earthquakes, 2011, and now pandemics. So in all these times, really, vulnerable people get proliferated, and you have to have very rapid and humane, compassionate action. And I think His Majesty has demonstrated this during this adversity in Bhutan as a aspect of collective consciousness of gross national happiness, in which human beings, human values are key, really. How to share during this period, prosperity, income is key, really. For example, it's quite rare that a leader of a country does this. He's all the time traveling, and then having traveled to southern Bhutan along the border where infection is high on the other side of Bhutan, for example, there is risk. And our government's approach is that even the king has to be in quarantine for 1 week after he comes from southern Bhutan to northern Bhutan, But quarantine from one perspective is wonderful. It is involuntary solitude during which you can reflect, do work, meditate. It is in this respect, it is very much in line with tradition, I would like to say. You don't see this as negative, as long as you know how to tap solitude without suffering loneliness. So we are now under democratic government, but the sort of source of this kind of compassionate moves, source of radical leadership is still His Majesty the King. I would like to say that during this king's time in 2011, we took gross national happiness to the United Nations too. As you might remember, as you may know, we were behind the declaration of the World Happiness Day by the United Nations, now marking March 20 as the World Happiness Day, during which people are urged to think really about holistic well-being and happiness. And of course, closely allied to that is public health too. You might also know that on that day, March 20, World Happiness Report is released every year, tabulating rankings of the country on the so-called international ranking of countries. But I bring this up only to say that the World Happiness uses data collected by Gallup World Poll in the United States. in a way comparable over 150 countries. The country rankings in the World Happiness Report are based on Cantrell life evaluations, along with positive emotions, level of enjoyment of the day or yesterday, and level of trust that exists in societies. I also mentioned this point about World Happiness Report to suggest to you that what it measures by Cantrell ladder, subjective well-being, 0 to 10, taking your life as a whole, where do you belong, that sort of question, is the instrument to construct the international rankings. The approach taken by World Happiness Report using Cantrell life evaluation and the approach taken by GNH measures, what GNH measures as happiness, the main thing I want to say is they are very different. The notion and concept of happiness in the World Happiness Report and in GNH is considerably different. And GNH measures many different things, as I will come to later on, and strives towards both and depth and breadth of what it measures. So this is by way of institutional background about GNH. Now, we decided to also construct a matrix of cross-national happiness. However difficult such a concept as happiness may be, we thought we should attempt and over time sort of get rid of its imperfections wherever we can do with research. And at that time, the concept of 9 domain was also identified through public discussion, through research, and through other processes of the government. And to itemize the 9 domains of cross-national happiness are shown here. This living standard, ecological diversity, community vitality, good governance, cultural diversity, education, time use over 24 hours, health, psychological well-being, and they are all weighted equally. So sort of they are all weighted equally in the calculation of cross-national happiness index. And you can, as you can see, the relative contribution of each domain to the overall index shown here, sort of dichotomized between rural and urban scores, overall scores. You can see that the urban Bhutan scores a little bit higher in GNH index, and men, if you compare gender, men score much higher. So it is sort of the GNH index is situated between 0 and high, 0 and 1, with approximation to 1 being always the goal. So to under each domain of GNH, there are on average 30 variables. And so the composite GNH index actually is constituted or is calculated by aggregating some 277 variables. That is quite a lot of information. But we need those because the sort of indicators have uses to different functional agencies. So the health ministry will have a set of indicators. The Ministry of Human Settlement will have a set of indicators that is generated from this survey, which takes place once every 5 years. So these are some of the technical considerations in selecting variables. I won't go into this aggregation part, which is only of interest to statistician. But let me show you another schematic chart of the 9 domains of gross national happiness. The assumptions about human beings, as you know, in GDP is very different and contrasting from the assumptions we make in GNH. In GDP, of course, you will have assumptions of human being as someone who can process market informations very well, who would know and detect the quality differences in the goods and services so that they will optimize their satisfaction, etc. In GNH, we think that quite a lot of well-being and happiness and the emotional flourishing of human beings depends on quality of relationship within communities, within families, and in the quality of relationship with the people with whom they matter a lot, with whom they reciprocate non-transactionally, non-commercially. This is one of the key assumptions we make in GNH. That is why measurements of happiness through community vitality, measurement of GNH through cultural diversity also become very important. We see people in GNH also as striving. Sorry, this is one word is missing here. It should be psychological well-being. Psychological well-being, it should be. So with respect to psychological well-being also, we see people, or we assume people as having some innate tendency to transform their mental state towards calmness, generosity, compassion, joyfulness, and away from anger, competition, etc. Jealousy. This is some of the assumptions we draw from our culture and also from these doctrines in Buddhism. This is sort of. And with respect to cultural diversity here, the measurements here take into account of the view or the perspective that people are cultural and historical beings. They are not only market creatures or consumers, they are at the same time cultural and historical beings trying to strive to preserve values which are very good intrinsically, trying to retain skills, particularly artisanship skills that give a lot of joy and abilities, capacities to people, and trying to somehow moor themselves, somehow anchor themselves in some notions of stable identities, which gives them dignity, which gives them esteem, which gives them some sense of coherence in a world which is changing so fast, in a world where the direction is of what destination awaits us is not so clear. People need identities. People need these sort of values. That's why. And this time use you see here, which is, um, conceptual framework, both derived from Buddhist psychological perspective, as well as time use studies done elsewhere in United States or other countries. And the main thing is we see people as really trying to balance their time use over 24 hours. We know from all surveys and information from all over the world that the time people need to see friends, time people need to take care of elderly people, time for sports, time for physical activity, for healthy maintenance, all are shrinking, and therefore there has a tremendous effect on happiness and well-being and health. So we try to measure how much unpaid social work is getting done, how much time is being devoted to daily physical activity, and how much time is being devoted to mental vitality, such as mindfulness, meditation, how much time people really enjoy working, that is time of meaningful work rather than time of work. And finally, we are very serious through our survey in ascertaining whether people have, at the end of what you call a meaningful and active and enjoyable day, whether they equally have enough duration of rejuvenating sleep. I can say that sleep time is not affected in this country. Maybe overall we are overdoing a little bit, is about 8 hours plus. But it's also cold in the morning, so it's good to be in bed. So I just show a little bit about the, for example, psychological well-being. When we say what is the structure really of the matrix of psychological well-being, these are measured. This emotional balance, positive, negative balance, positive emotions like generosity, calmness, enjoyment, compassion. Negative emotions like anger, jealousy, those sort of things. Four. General health questionnaire is, as you know, a measure of general stress level in the population. And here it shows is about 4%, and not such a great figure. I think 4% is nudging towards comparable proportion in the West. Spirituality practice like meditation, we are not concerned whether it is meditation in Hindi tradition, Nepali tradition, Buddhist tradition. It's just that something of that sort must, we count the duration that goes in. We don't know, we don't count what exactly is practiced, but the duration. So that's the structure of thing. But if you see the structure of community vitality, we measure under that quality of neighborhood, how they reciprocate non-transactionally, non-market wise, how much time they give, how much materials they give to each other, what sort of trust level within the community, do they enjoy a deep sense of belonging. By the way, we found out that to have really a great level of trust and great level of sense of belonging to a place, it takes 6 years of being in that place. So it grows with time only, and then reciprocity of free labor, free exchange of labor, money, sort of things, and the quality of safety in a place, human harm, crime, enmity level, we measure very seriously the disagreements that exist, prevails in a community, whether it is growing or going down, because this is really a very serious source of alienation and distancing between members of this village, for example. And we ought to track this as a measure of peace, man-made peace, measure of man-made peace, crime, enmity, and the quality of relationship within the family and in the neighborhood. So these are the measures of how the community as an independent organism is thriving, within which individuals are insignificant players in a way, because the environment and quality of the relationship of the community affects those within the community. Really, that is the main point. Of course, I could go. Of course, I could go. Professor Randy, how are we doing in terms of time?
Kara, we're doing well. Maybe if you have maybe 15 minutes and then time for questions.
Oh, only 15 minutes. Okay. So then I have problem. But a lot of things are technical, really. I think I like, if time allows, I like to then rush through how we technically apply the evidences we get from the survey to governance. This is the what I would like to say.
Did you want to show your video?
Yeah, that takes 8 minutes.
That would be fine, I think.
Okay, thank you. In that case, okay, this is a video taken in our survey in 2010, but things haven't changed. Things haven't changed. The survey takes place like exactly in the same way as it is shown in this video taken 10 years ago.
아들랑라서 신이들이 같은 온데 알루 추구 손이 돼가 디솜니 노사라도 아니네.
대만 인간의 리면 나 사대대 불하기로 되는 거지. 나 유칼리디 들도 기디 미토블 때문에 아니 중기 롱레슈.
내가 엄상일 한 무서워. 양이 시거든.
시. 비하는 kilomni chole am sui de la.
같이 좀 배우들은 남성이 좋아하는 뭐지?
네. 맞아. 센터 맞아. 아무래도 잘해서 좀 재밌지. 이제
그 갈람 지 아시르기 무슨 들이 좀 못었어. 마찬가지 사갈 총이 투기로 땅에 충실이라 이거지. 저기 생각이 사지.
우리 재미풀이 가기 중요한 나라 카드를 된다. 그래서 자체를 가도 기존에 유해서 중요한 나다. 아무리 기존도 자체를 배워 진짜 숨추대 저기 맨날 가도 기존도 내가 시티 프로라 좀 이디. 내 프로그램 잡는 날도 또 올리는 날도 나 나자 게임들이 세체 사다 배우다. 또 해결아 좀 더 집고 가는 거야.
공기감 측면들 측면들은 사회의 공기심만 마시는 거다. 잡주들은 그런 거. 잡주들 그런 측면. 지금도 미야르가 바로 아니야 바도 참kamse 바로 내가 이자매가 이나와 자리 잠들 이들 거기서만 나는 모르겠어. 자리 거기 잡지가 없는 나. 무슨 나가다니. 추승긴 들어가는 지금
출신들이 저 수모 뭐 시는 무슨 같이 기술이가 무슨 같이
생각하면 선대로 딸의 준비 때는 뭐라 균이게 강화돼 다니 나가 생각하는 거 보면 기도 쉬는 쉬고서 넘어나도 담마들 로디 아주 춥죠 좀 막아 로 잡아줘 좀 막아 그럼 진짜 깨서가 표현화 자고 안 좀 되는 아주 되게 하나 지금 수치를 되게 내신데 주제를 달아내지 못수 근데
Saudila, jasa umma chuda dan da sa umma.
수나 저 건다 땐 사적골라. 사수관에 듣더니 잔이 안에 짐이 타고 맞았어요. 저는 먹기. 내년 서다고 돈날 때고.
어제 쇼디 다 그때 주도 쓰면 다 열심히 주도가 세우고 주도가
바로 야라 로지를 넣지 주기 야라
열심히 주도 쓰면
영건한 주로 이제 이기미시베르 테러시 돈이 왜 다주
하나 배워 주도 뭔가 나서 너무 나서 많이 배도가
네, 아니 배도가.
비야
그 나오르나 삶이 수시되는 내가 너무
저긴 속도 저긴 나온다도 라마도 수능만
이게 뭐지면은
침사 디스기 침날 아우 마셔봐
마소
드라마 암서 자자비에 미가
니니나
드라마 기타 셈치 디스기 따다 돔 디스기 오메 서다봉세
아니야 돈이네
지금 남 소심에 지안을래와 템베 아말레 포디 온고가지 와 더더러 제다 딘디스 템베 잡아서 미더가
자원의 돈입니다
미가
네미나 자원이가 지내다에 살로 신 아니 지추지를 잡아
잡미도 뭐
So some part of the surveys are, as you see, quite adventurous. Traveling with yaks, camping, and walking a lot, trekking a lot, and to meet people, to understand really from the grounds up. So this has been happening, and we are about to do this year, 2021 again, so that we can build benchmarks for the next 5-year plan. So I would like to conclude by saying how we use in technical ways in governance. First of all, this sort of division of the population according to gross national happiness is there: deeply happy, extensively happy, narrowly happy, unhappy. So most people in Bhutan, as you know, are in this narrowly happy category. And really, it's very easy to move people from unhappy to narrowly happy or extensively happy. But we have found over successive surveys that the deeply happy category remains roughly at that level of about 9-10%. They are the ones who are equipped not only with material sufficiencies and positivity, etc., but something fundamentally enduring in their personalities there, that the vicissitudes of life, do not affect them very much. That is a sort of a kind of a robust mental quality issue. First, technical use of GNH index is really to track over 5 years what is changing underneath in a little more granular way. And you can see here that over the 5 years, really a lot of things improved, but positive emotions decreased, negative emotions increased. Also, community vitality indicator decreased because donation of time and money, etc., decreased. So that's one use of as an overall sort of benchmark for the 5-year plan. Another way of using GNH index is that index is used as a weighted criteria in the allocation of budgets amongst the local governments, and there are 205 local governments in this country. It's a bit like micro Roman cities where democracy is practiced. There are only about 300 household in each of these units, local government, and 40% of the capital of the country is divided according to the resource allocation formula, heavily influenced by gross national happiness index. The overall influence is that those who score very low in GNH index gets more money. So that's the second use. So, for example, the criteria for division of money or budget is sort of, you just look at the new one, is distributed, weights are distributed like this. The third systematic technical use of GNH indicators and variables is that policies of the government have to be screened by GNH screening criteria, and these are 26 criteria drawn from the GNH domains. So there is a well-established procedure to vet the policies, and so far about 16 policies have been screened over the years, over the decades. And the value of this is that the policy gets modified in the process of screening it by GNH. Another use of GNH technically is in the evaluations. Of course, there are many forms of evaluation methodology in the world, but we developed one according to our GNH. This is a different, slightly different from GNH index. It's an evaluation methodology we developed, and it can reveal the sort of diverse impacts of a project on community vitality, on psychological well-being, on time use, etc. And that's very useful to get, multiple views of a phenomena. Then the last function of a GNH indicator is really to certify the process of our businesses while making money. It is not the how profit is shared, which is so important, really, but how the money, how the production is in keeping with the GNH principles and criteria. So actually we have finished GNH certification of very big corporations in Bhutan, such as Bhutan Power Corporation, Bhutan Bank of Bhutan, etc. And the business certification of these companies will be given away this month by the Prime Minister of Bhutan. Overall, then the scheme for GNH in governance is something like this. You can see that projects are guided by policies aligned to goals aligned to national goal, and each analog in GNH is GNH single index, GNH indicators, GNH budget formula, screening tools, etc. So I thank you very much for your kind patience and attention.
Carmen, that was magnificent. Thank you for that. The question came in, are there plans to address gender differences in gross national happiness?
Indeed, because one of the not very unpredictable unexpected finding is that the GNH index shows lower score for women here, but we found out because the data is quite good. We found out that the discrepancy disappears if we isolate women below 50 and above 50. So the gender score is lower, GNH score for women is lower if the data is segregated to below 50. Above 50, between male and female achievement in GNH, there's no difference. There's no difference. This led us to investigate a little more carefully the cause. And we tentatively came down to the view that the intensity of care that mothers have to give to children on the one hand and elderly people on the other, because they are the main social caregivers, is playing probably a dominant role. And we have to unburden or reduce the burden on female on this count. So program has been started in Bhutan, but program actually took a monetary form now. That is that all mothers who have children will be given allowance throughout the country.
Carmen, there's two other questions that have come in. One is, how much of the national budget is spent on GNH?
We do not have a GNH and non-GNH segregated budget, but normally the lion's share of budget is given to roads or economic production sector in other countries. But in this country, priority in budget allocation in terms of amount is given to two sectors, which are health and education. And here, health encompasses both indigenous medicine, health, indigenous, slightly like the Tibetan medicine or Ayurvedic, but slightly different. So there is a parallel system here. And this year is the year of main investment in mental and psychological well-being. So lots of programs have been started. New hospitals devoted to that is built up. Of course, in terms of softer options of how to support mental health, Buddhism has been a champion, as you know, on that. And we have spent a huge amount on the monastic education in this. So I do not have a number, but if you look at health and education, it instantly comes to 30% of the budget of the country.
If a community was interested in improving its G&H, what advice would you give them, whether it's in Bhutan or in the States?
Of course, over a longer term, we also need the infrastructure, meaning physical things, good road, good water supply. This is sort of the material approach. But I think the key about the community for it to flourish is that we need intelligent people within the communities, cultural icons, artistic people, doctors, leaders, sort of intellectuals, no matter what, how small the community is, every few villages, we need somebody like that, because they, in the long term, add sort of glamour, add fascination to the community. However, I think closeness, sharing, fraternity are the sort of main ingredients of a community. If you think this is also an extended family. So to be for a community to be a complete, in a case like Bhutan, all age groups have to be there, all age groups. All creatures supporting a community has to be around also. A sort of, it's an expanding circle, like old cows also member of the community in a way, having supported the community. So the quality of the relationship is at the end, I think, the hallmark of a good community, quality of a good relationship, enduring friendship, enduring social support, familiarity of being able to trust somebody and have the full sense of safety of living there. I think the material condition problems are all solved, in my opinion. It is the post-material conditions we have to cultivate ceaselessly.
That's very helpful. I'm reading all the questions. There are probably a great deal more questions than we can address. One of them is, do you see G&H as a competing metric as a way of evaluating overall well-being compared to the traditional Western metrics like GDP, GNP, and so on?
I think there is a danger that GDP overshadows all well-being matrix. Well-being matrix have not been able to come to the surface of leadership's thinking, politicians' thinking, and the economists who more or less manage the world today. They're always talking about the trade deficits, inflation. This consumes them, and it's not very easy for us to put forth that this is a subordinate measure. We need these sort of measures, but they are subordinate to well-being measures. Within the sphere of well-being, standard of living does play a role, but it plays only a role. It doesn't play, I think, our mind dominant. As soon as the poverty questions are solved, really, it doesn't play a dominant role in my mind. Except for corporations whose sole devotion is to sort of make more and more profit. So for ordinary people, after the problem of prosperity is solved, that is adequacy and sufficiency is solved, really it is the well-being matrix that should overtake. And that applies to a large portion of humankind, I think, who have, who are now looking for further, deeper experience in life, not consumption experience, but more meaningful experience. So if we can manage from the public health side, from the environmental side, from also this kind of well-being and happiness disciplines, there is some common cause, I think.
A magnificent presentation and many positive comments. One question that's come up several times is, you had mentioned international rankings of countries by a happiness metric, which is obviously very different from Bhutan's GNH, but where could we find that listing of countries? Is there a...
Yeah, this is the committee which produces this is, Professor John Halliwell from Canada and Jeffrey Sachs from Columbia University. They are the ones who are editors. Of course, I also I'm not very helpful, but I also sit on the governing sort of council of this booklet. You type World Happiness Report, you get it. It's free.
Well, Karma, I cannot thank you enough. It's now 11 o'clock, I believe, your time, and you're cutting into your sleep, which is very important. But I hope you appreciate how important what you have said is to us. I think many of the comments are that right now our country is not enjoying a great deal of happiness. And I think the idea that we can and should focus more on that resonates with a lot of us. At least it certainly does with me.
Thank you.
Thank you. And thank all of you for being a part of this. We do, Dr. Ura has agreed to allow us to record today's presentation, and we will get his permission to post it online for those of you who may have missed it. Karma, thank you so much. And I hope that we can stay in touch as time goes forward.
I would be very grateful, Dr. Randy. I would like to seize this momentary encounter with you to also kindly consider one or our researcher to receive your enlightened education. We have about 100 graduates in our institute, and so
well, we
continue.
Well, Dr. all of our master's degrees are available completely online. So someone could actually complete it from Bhutan without ever having to visit us, though we would certainly welcome a visit as well. And perhaps we could talk offline about how we might arrange that.
Thank you. Thank you for the opportunity. Thank you for your time given to me. If I talked in inadequate ways, thank you very much.
Thank you. And thanks everyone for listening, and take care now. Bye-bye.